Here in Bexley, we've got very ambitious plans around health and social care integration. Actually, we're making those more real here than I've known in other places. One of the outputs from that, if you like, one of the things we've already done, is to put community health and adult social care and mental health together in Bexley Care. And that's with our local community trust provider, Oxleas, but that's part of a much wider system integration. And Bexley Care, which was born in April of last year, actually gave rise to Discharge to Assess as a function. Now, Discharge to Assess is one of the high impact change aspects that the government have asked us to introduce to ensure that people don't stay in hospital a day longer than they need to. So we're very early adopters of Discharge to Assess. It's had a really profound impact already.
I'm the General Manager for the Hospital Integrated Discharge team at Down Valley, and my team of nurses and therapists visit wards daily to look for patients to support discharge. The Discharge to Assess programme that Bexley has supported with us enables us to transfer patients home from hospital much more quickly in their pathway than would otherwise have been available to us. The main benefit that we've noticed is that patients who have complex needs can be assessed in their own home rather than staying in an acute hospital bed. With the enhanced care that Bexley provide to these patients based on needs assessment done in the hospital by my team, the patient can go home with almost round-the-clock care, have their needs assessed at home, and then the care be stepped back down again as appropriate. That helps us discharge patients more quickly, and it also helps with the social and healthcare costs because patients don't go home needing long-term high-level care. Once they're assessed at home, there's a much better picture of the care that they actually need.
I think the Discharge to Assess works very well. These are patients who can be going home into a familiar environment, into their own home, and all the assessments are done at home. So I think it's excellent, and we know that healthy patients spending 10 days in a hospital bed really kind of causes about 10 years of muscle aging. So it's crucial that we get these patients out of hospital rather than leave them stranded in hospital. I am a GP in the Frogner locality, and in Sidcup we have a very high number of elderly patients. And one of our elderly ladies went into hospital. She had a fall, she fractured a hip, she had hip surgery, and obviously needed a lot of extra support. She needed a lot of physiotherapy. She needed modifications to be done at home because now her mobility had changed. And traditionally, this lady would have stayed in hospital till she had all these assessments. Whereas with Discharge to Assess, when she was medically fit to go home, she actually went home and she had all the assessments done in her own house. I think it's a great example where obviously this lady who potentially could have been sitting in hospital, we know that in hospitals you have a higher chance of infections and bed sores, and we got this lady out and she was in her own home having all the assessments at home, which was, I think, brilliant.
Social services were wonderful. They sent him a special electric bed he had bed sores. They sent him a special mattress which electronically vibrates, and the vibration will help his bed sores. And I'm very grateful to the social services for doing that. They've always been there for me. If I have many people to ring, and if I need any help, I can always get it. And when you're on your own and you're frightened, it's wonderful to know that these people will care for you and help you. And I can't say one thing against them because of the kindness they've shown to me. He was doubly incontinent. He'd be doubly incontinent in there or at home. Nothing they could do for him. He was very depressed. He cried all the time, constantly cried. Can I come home? Can I come home? Why have you put me in this place? So when he was returned home, the GP gave him medication which cheered him up and he no longer cries. He is now a happy person. In fact, he is the happiest of all of us. At the moment now, with the medication from his GP, he does not cry, and I would say he's a lot happier now being at home than he would be in hospital.
D2A has been a massive change and quite a culture shock for Queen Elizabeth, where we were so used to doing certain paperwork to facilitate discharge home, and really with the patient focus again just being there for the patient, and social services being able to have time in the community with the patient to get an accurate reflection of their needs has benefited. The process through the hospital, packages of care are much quicker in D2A, paperwork is less, so the whole process through the hospital is much easier.
I think another benefit actually that is really important to flag is that this model of discharge to assess that we've worked closely with the Bexley team on has actually had another hidden benefit, which is it's really helped to build relationships between the hospital discharge team and health and social care staff in Bexley, and I would say that our relationship overall, our working together, is much better than it was before this came in.
So in terms of our integration agenda, we already have signed the Memorandum of Understanding. That's every system, every player in our local health and social care system has signed up to say, in the not too distant future, we want to be a proper integrated care system. It's a bit of a well-worn phrase now, but the idea of the Bexley pound, that actually we don't have a set of individual budgets, but we have a resource available to us, whether that's the money we've got or the people we've got, all working together to get the right outcomes. And I think Discharge to Assess is the first product, I think you might say, of that ambition.